Hello, my name is Aaron Villarreal, nurse anesthetist and pain fellow at Texas Christian University. This presentation is for patients with PTSD, post-traumatic stress disorder, and pain. This presentation is very informative, yet very simple. It will focus on the physiology of PTSD and pain, medical treatment, and especially in alternative treatment modalities. During nursing school, reading about PTSD made no sense to me, much less did I know about the intimate relationship of PTSD and chronic pain. In PTSD, there is a disconnection between the amygdala and the medial prefrontal cortex of the brain. This disconnection leaves PTSD patients unable to control emotions and impulses. The amygdala is part of the limbic system and is responsible for emotions, survival instincts, and memory. The medial prefrontal cortex is responsible for behavior, personality, expressions, and decision making. We now know with scientific proof of the disconnection as appreciated in these pictures. In picture number 1, medial prefrontal cortex is connected to the rest of the brain. In picture number 2, we can appreciate in a patient with PTSD, the amygdala and medial prefrontal cortex are no longer connected. The disconnection between the amygdala and the medial prefrontal cortex in PTSD patients is the reason why they experience anxiety, crying, and panic attacks, among other symptoms. The disconnection does not allow them to control their emotions and impulses. Neuroimaging is scientific proof that patients with PTSD have activation of the subcortical brain regions and reduced activity in the medial prefrontal cortex. Serotonin, a neurotransmitter, is also involved in PTSD. Serotonin from subfamily 1A is very abundant in the Raphe nucleus, where serotonin has its analgesic properties. For years, the main line of therapy has been medical management. Antidepressants medications such as SSRIs, SNRIs, and tricyclic antidepressants work by having more serotonin and norepinephrine available in the brain. Side effects of medications such as weight gain, dry mouth, and sedation, and bigger complications such as serotonin syndrome has made us to think outside the box for different treatment modalities. Alternative pain management treatment modalities such as yoga, cognitive behavioral therapy, mindfulness therapy, and hypnosis are currently being used to treat pain and PTSD. The National Institute of Health has shown that 10 weeks of yoga markedly reduce PTSD symptoms in patients who have failed medical treatment. Yoga has shown to improve arousal problems in PTSD patients. In other words, patients regain the ability to control impulses, and emotions. Due to the brain disconnection in PTSD, basic meditation such as mindfulness allows PTSD patients to recognize emotions and impulses. By doing this, they regain the ability to control such emotions. Cognitive behavioral therapy focuses on changing dysfunctional thinking from a disconnected brain by reframing negative reasoning. Hypnosis can induce a state of relative calm from which PTSD patients can observe their traumatic experience without being overwhelmed with emotions. The Pain Management Fellowship has given me the tools and knowledge to properly treat PTSD patients in the chronic pain clinical setting.